Hello, I'm Dr. Joyce Alberts, clinical psychologist based in North Canterbury, South Island, New Zealand. This is a video channel that I've created on YouTube as a bit of an experiment to see whether people are interested in similar topics that I am and whether they're willing to engage and connect and to learn and share more about these topics. In my previous videos, I've introduced myself, explained a little bit more about my journey in psychology, and in the last two videos explained why I'm interested in a particular trial that has been conducted in the United States, Florida as we speak. And this is the trial related to Maya Kowalski, who was a patient in 2016 at the Johns Hopkins All Children's Hospital. So I just want to revisit some of the things in my previous video. If you've watched that, you would have seen at times it was quite difficult to talk about that topic and brought tears to my eyes. It was a personal tale or story. It was a real life event actually, of my experience with my young daughter at the time when she was admitted into hospital. So just to recap, if you haven't watched that video, my daughter was at that time 11 months old. So I just paused that video because I just wanted to do a wee check-in. So I was talking about my daughter who at the time was admitted into hospital due to what was medically at that time referred to as failure to thrive. I mentioned in the last video that she was around 11 pounds when she was admitted. So I've just double checked that conversion. So at birth she would have been just roughly 3.1 kilos, and by the time she was admitted into hospital she was 4.9 kilograms. So that gives you an indication that over a period of roughly 8 months she had not put on a lot of weight. Just want to clarify that initially she was a entirely breastfed baby up until the age of about 3 months, and retrospectively we can see that during the first 3 months normal weight gain, and then once she was put on to formula the weight gain plateaued and was very little weight. I mentioned that at the time of admission to hospital she was self-supporting, she could sit without support, and within 2 to 3 weeks she required support. In fact, she would be propped up in a pram in the hospital. The paediatrician who was head of paediatrics at the time was very dismissive, quite abrupt, and had come to the conclusion after extensive testing there was nothing medically wrong with our daughter. It was simply a matter of fact that I had not been feeding her properly. As I mentioned, the treatment from admission into hospital was a high protein formula fed by bottle, which was fed either by myself or the nursing staff every 2 hours. And in fact she was losing weight, losing condition under that treatment. Thankfully, the correct diagnosis was found near the end of our stay in hospital, and she was diagnosed with severe dairy product allergy. She once taken off the formula that the head of paediatrics at the time had put her on, she in fact taking her off dairy, she put on 750 grams within 3 days. So it was quite conclusive that dairy product allergy was the underlying cause. On discharge from hospital, she continued to thrive, to gain weight. She was able to very quickly develop a sufficient muscle development so that she could sit unsupported, and by the time she was a year old she showed no signs of the difficulties she had at the time she was in hospital. She crawled and she was walking, all within normal milestones. In fact, the dairy products allergy was sufficiently severe that the diagnosing paediatrician had a discussion with my husband and myself that it may not be wise to consider having further children, that the dairy product allergy was likely to become more severe with further pregnancies. After a number of years, rightly or wrongly, we were very blessed to have another child. During this pregnancy, very early on in the pregnancy, and much to everyone's surprise, the dairy product allergy reared its head. In this case, at around 3 months pregnancy, I developed what can only be described as raised welts, spreading all over my body, chest, arms, abdomen, back, legs, etc. Took a few weeks for us to figure out what was going on, and we checked in with the previous paediatrician who diagnosed dairy product allergy, asked the question, was it possible that our baby in utero was reacting to dairy products? He said it had not been something he'd come across before, but given the severity of our older daughter's case, that nothing would surprise him. Test was, I came off dairy products entirely, and within 2 to 3 days my skin had resumed its normal texture and colour, and I and all the welts disappeared. However, a second episode during the pregnancy in which someone cooked a meal for around 6 adults, unbeknownst to myself, had stirred a teaspoon of butter through that meal, and that very night the same thing occurred. Raised welts all over my body, my skin just inflamed on fire. I spent most of that night in and out of the shower, cold face cloths just pressed against my skin, just trying to calm my skin until my husband and I were able to access antihistamine the next morning. Sufficient to say we became very vigilant about checking to make sure all food I ate during my pregnancy and subsequent breastfeeding was completely dairy-free. Largely this was successful, however we noticed that again our daughter was not quite thriving the way we would expect, and after about a year further investigation indicated that she had an underlying bowel condition referred to as Crohn's disease. It's really a syndrome, not actually a disease, and from the age of about 1 year till 12 years of age she was actively treated for that condition. The reason I'm talking about this was because, just a reminder that in the previous video I mentioned the head of paediatrics had dismissed me as a young mother, had come to determine that whatever was the cause of our older daughter's condition was due to my actions, and that I had not been feeding my daughter properly. And I'm just highlighting that this was a very real medical condition or difficulty that our children had, that they had sufficiently severe dairy product allergy that it was in fact life-threatening, and we experienced that on a number of occasions. Why is all of this relevant? This is because I'm talking about initially 1985 and then later again in 1991-92. With our youngest daughter, she, because of the underlying health conditions that she had, she became very susceptible to strep throat infections, and in fact in 1 year she had 12 such infections. We had discussions about whether it would be wise to remove tonsils, and we were advised that it was better and easier to treat the strep throat infection than to risk removing tonsils or the adenoids, and that the infection then could go to other internal organs. One occasion that stood out, and this is again related to as a mother advocating for your child and medical professionals maybe not listening. So it's actually 2 occasions. So on one occasion, our youngest daughter, who was about 3 years old at the time, had gone through so many of these strep throat infections that as a mother you become quite attuned to changes in your child's health and well-being and seeing the patterns, signs and patterns. In this case it happened to be Easter holiday weekend. We had been to church service in the morning, and by early afternoon I noticed that our daughter was she was quite lethargic. She took herself to lie down on the floor in a lounge that we were visiting. I looked at her and I said to my husband, she's not well, I'm going to take her to after hours. So immediately took her to after hours. Long discussion with the doctor there. It was not our normal GP, but was impressing on this doctor that every time she became ill, she would lose 200 to 300 grams in a very short period of time, and on previous occasions had to be admitted to hospital where she was dehydrated, requiring nasal gastric tube feeding. I was very concerned that if we waited until the GP would have been open, which would have been the following Tuesday, she could become very sick, very unwell in a very short period of time. After a long discussion, the GP agreed to prescribe the medication, antibiotics. He did the throat swab. He acknowledged he was reluctant to prescribe antibiotics without a confirmed strep infection, a streptococci infection I think it's referred to. Not an expert in medical areas at all, and I do not claim to be. I'm simply a mother. So he did the throat swab test, and of course that went off to the laboratory, and we were not going to get the results to the following Tuesday once the holiday period was finished. The lab results came back. I'll just back up. So my daughter was on antibiotics during this weekend. She was obviously unwell, but did not deteriorate further, that we required hospital treatment or admission over that period. On the Tuesday, the lab tests results came back, and lo and behold, the GP rang me to say they were the highest count of strep infection that he had ever come across. It was clear from what he expressed to me in that telephone conversation and the tone of his voice. He was alarmed, he was surprised, and he was also grateful and thankful that I had been so insistent that he prescribed the antibiotics despite not having had a confirmed diagnosis at that point. So that was one positive experience, that where a medical professional, a GP in this case, was not quite sure of what I was saying, experienced me as a very pushy mother, as a mother who was advocating for medication for my child, but he agreed to do that, and turned out I was correct. The second incident, similar, but this involved a physical injury. So now our daughter, I think she would have been about 4 or 5 at the time. So she sustained a knee injury. It was quite a severe injury, required some stitches, and I'd taken her to a local medical centre. Her knee was clean, the wound was cleaned, stitched and dressed. The doctor at the time said we'll put on what was called a wet dressing for the first 2 days, and then she'd move to a dry dressing to allow the wound to heal. I again raised the concern about her underlying medical conditions, both with, especially with what we knew at that time was the Crohn's disease or Crohn's syndrome, and that along with that, because it does affect the immune system and it's an inflammatory condition, that she showed the symptoms that she would not heal as quickly, that it would take longer for her to heal, her skin to heal, than you would expect normally. As I described this and spoke about this with this GP, he literally rolled his eyes at me. So again, I'm being a mother advocating for my child, explaining from my knowledge, my experience, and the history of what we had gone through, and just letting him know that I would expect that she was going to take longer to heal than he expected. So we go through the dressings, go through the first initial wet dressings. On the day that she was supposed to go for a dry dressing, the nurse looked at the wound and said, no, we're going to have to stay with a wet dressing. The wet dressing continued for the next 2 to 3 days, and I think it was on that 3rd day the doctor came in expecting that he was going to see a wound that was nearly healed, and that we'd be planning to take those stitches out and that she'd be well on the way to full recovery. He came into the room and the first thing he saw was that she still had this wet dressing on. And he asked the nurse, why does this child have a wet dressing on? She should have a dry dressing. The nurse explained that the wound was not healing the way we expected. The doctor asked to have a look at the wound, examined the wound, turned around to look at me and said I was right, and she still required a wet dressing for another few days until the wound was sufficiently healed that she could sustain a dry dressing. So that was the second occasion. Again, why is this important, and why, through my experience, am I so interested in this trial in the United States? And that's because I don't know the outcome of this trial. It's still underway. I'm not an expert, and I hold no expertise in pain disorders such as chronic regional pain. But listening to this trial, I've heard the criticism of a mother who strongly advocated for her child and her child's well-being, was speaking from her experience with what her child had gone through. And medical professionals, nurses, social workers, and even paediatricians were sceptical, doubtful, critical, judgmental, to the point of laying making a phone call or a notification to the Child Protective Services within their area, resulting in a court case in which the mother was prevented from seeing her child, having contact with the child. In fact, the child was put in essentially protective custody of the hospital, kept within the hospital for a further 80-odd days. What struck me at the time when I was following those elements of the case is that it never occurred to me back in 1985, when my daughter was admitted to hospital, when I was being, if you like, investigated or watched and criticised, judged for being a poor mother, not feeding my child properly. It never occurred to me that that could have been an outcome. And in fact, when it did hit me the other day, I was left quite emotional. And I know I'm talking about something that occurred more than 30 years ago. It's well over 30 years ago. But it really struck me to my core that that could happen. And in fact, did happen in this case. And it really concerned me that the investigation into whether, in my case, whether I was the cause, that didn't seem to occur to the head of paediatrics at the time. Facts such as my daughter losing weight under his care, the fact that she lost muscle condition to the point where she could no longer support herself in a sitting position, that didn't seem to be a factor. And in listening to some of the evidence and testimony in Maya's case, it seemed similar, that prior to her admission to hospital, the physiotherapist who'd been working with Maya seemed to have made quite significant gains and was happy with her progress. And yet when she was discharged from hospital eventually after nearly 3 months, her condition had significantly declined. Those factors don't seem to be addressed in this case. I'm going to continue to watch this trial. When the verdicts are reached, might have a discussion about that, and maybe some people might want to add some comments. Maybe we can look at some questions. But one thing that seems to be very clear with the case over in the United States, whatever the verdict, this is a case that will not be finished with the jury presenting their verdict to the court. This is a case that will linger on through the appeal court, potentially for many years to come. The sad part about that is that this is a case about a young girl's life, the life of her family, and the tragic loss of her mother. Whatever the outcome, I wish Maya and her family all the best. For those that have followed my videos so far, and much to my surprise, there have been more people watching these videos than I expected. Pleasantly surprised and encouraged. And should people like these videos, maybe even add some comments, I'll continue to post some videos. So in the meantime, all the best, have a great day, and ka kite. Bye bye.